You ready, Mr. Mays?
Yes, sir.
We don't want to start without you.
Go ahead and start with our judge.
Clerk will call the roll.
Glenn Whitley, County Judge.
Here.
Roy Charles Brooks, Commissioner Precinct 1.
Present.
Devin Allen, Commissioner Precinct 2.
Here.
Gary Fickus, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4. J.D. Johnson, Commissioner Precinct 4.
Come on, JD.
Here.
Constitutes a
I'm
quorum.
There you go.
Constitutes a quorum.
The invocation today will be delivered by Officer Hodnett from Tarrant County. We appreciate you coming out today. After the invocation, please remain standing for our pledges.
Good morning. Pray with me. Our Father and our God, Father, we come to you this morning with thanksgiving in our hearts. We thank you for your grace and we thank you for your mercy. We come, Father, asking that you be with this nation as we go through this virus. But, Father, we know that you're still on the throne. So, Father, we just ask that you comfort each and every one of us. Father, be with this world, be with this country as we strive to just help one another and get through this. Be with this Commissioner's Court and all of the courts in the lands, Father, as they do their due diligence to do what must be done. Father, we love you and we pray that you continue to bless us as you see fit. And we thank you in the name of Jesus the Christ. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Thank you.
Officer Hodnett, we appreciate you being out here today. Officer Hodnett is also the pastor of Trinity Park Church of Christ in that county to the east of us. So we appreciate you realizing where the best place to work is, and we know that they have a lot of people that need saving over there. Mr. Manius, agenda announcements.
Thank you, Your Honor. Members of the court, once again, we're going to deviate a little bit from the order in the agenda, and are going to push all the COVID-19 related issues up to the front. We've got a number of those. One of the things that we're going to also do, we have Guidehouse, which is the consulting firm that the county had engaged last week, and we've been meeting with them. They're going to make a audio presentation to you this morning, and hopefully, Judge, if we could do that probably right after Dr. Tenaza's presentation. Also, members of the court, as it relates to that, there are several items that we are going to be covering especially when we get to item number A2 under the administrator's section, and I will attempt to walk you through those items when we get to that point. I believe we've also included those court communications in your red folders this morning, plus I believe we sent some out to you yesterday. And then finally, members of court, as it relates to the agenda specifically, under County Judge and Commissioners, item 9K3, these are interlocal agreements in Precinct 3. We're going to hold those items until next week or until we're ready to bring those back to court for you. Also, members of the court, we do have a PEBC meeting. That's tomorrow at 2:30, and I believe that's going to be a go-to meeting. So I know that two of you are members of that board, and we'll make sure you get that information if you've not already received it. Thank you, Your Honor. Oh, by the way, Your Honor, we do have some public hearings this morning.
Okay. Court members, you have before you the minutes of our regular meeting of April the 28th.
Move for approval.
Second. We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Next, we have a couple of proclamations. I have a proclamation for Commander Colin Cordon Day. He is last Friday he retired from command of the USS Fort Worth. And so that one's for ratification only. I'll move approval.
Second?
We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Yes.
And we also have a resolution for National Asthma and Allergy Month, which I will also, is for ratification only, and I will move its approval.
Second.
We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. You want to make an announcement?
I would like to.
Can you give me just?
Yeah.
No, go ahead and make your announcement.
You sure?
Yeah.
Okay, thank you. Well, good morning, everyone. I just wanted to be sure to announce our next town hall that we are hosting tomorrow evening from 6 to 7 p.m. This one will be focused on child care in Tarrant County. So we're appreciative to have folks from Workforce Solutions of Tarrant County, Boys and Girls Club of Tarrant County, Best Place for Kids, and Child Care Associates. So for any of us that are caring for our own children or perhaps others, it's important for us to know what resources are available within the county. It's important also for employers to know what resources may be available to their employees for child care. So again, that is tomorrow, Wednesday, May 6th, 6 to 7 p.m. We'll be doing a Facebook Live on child care.
Thank you. This is the first Tuesday, and normally we would have a room full of employees, and this is unfortunately the second one we have had to postpone. And we did, however, I did do a little video, and so I'm going to, I think, turn it over, and we're going to do this a little bit.
Good morning. Well, this is the second month now that we've not been able to hold our employee recognition in the courtroom, and I can't tell you how much I miss seeing each one of you here and having the opportunity to mispronounce your name and to have an opportunity to really thank you for the tremendous amount of work you do for Tarrant County, and as a result of that, how great you make this as a place to live, to work, and to raise a family. I miss you. I know y'all miss being here. We'll get started again. Hopefully, maybe we'll start back in June. But I did want to let you know how much I miss this and how much I look forward to being able to get back to doing these first Tuesday recognitions. Thank you and have a great day.
Here are the employees for April. Again, a total of 910 years of service. And here are our May employees. Now remember, we would normally, and there's the remainder, that's 780. We would normally be out on the lawn. Judge Carr and his band would be playing. We'd be avoiding the sun, or some of us would be. Yeah. And we would be reading everybody's names out there. We'll get back to that. We're on our way to getting back for that. But again, I just want to tell everybody how much we appreciate the service for those of y'all who are here, as well as for those who are working the front lines, and we just very, very much appreciate everyone in Tarrant County and the job that they're doing. So we'll get back to that. I promise you we'll get back to that. And with that, court members, I'll move, well, I don't know that I guess I can move that we'll receive and file it.
That's correct.
And then we'll receive and redo it when everybody comes back.
Second.
We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Okay. Court members, you have before you the consent agenda.
Move approval of the consent agenda.
Second.
We have a motion and a second to approve the consent agenda.
please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. We have some public hearings today, and who's going to come on down?
Morning, Judge. Morning, members of the court. I have 3 public hearings for you this morning, all in Precinct 3, or Precinct 1, I apologize. The first one is to consider the placement of speed limit signs in Hinkin Ranch subdivision in Precinct 1. This comes after the request of the residents that live in that subdivision.
I will open the public hearing at this time and ask if there's anyone here wishing to speak to this matter. There appearing to be none, then I'll close the public hearing.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Next public hearing is also in Precinct 1, stop signs in that same subdivision, Hinkin Ranch, coming at the request of those residents.
At this time, I'll open the public hearing and ask if there's anyone here wishing to speak to this matter. There appearing to be none, then I will close the public hearing.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Third and final public hearing request is to install speed limit signs in the Precinct 1 Mayfair South subdivision. That was actually brought to our attention also by constituents in the area, and after a speed study, we have determined that 30 miles an hour is accurate for this subdivision as well.
I will open the public hearing and ask if there's anyone here wishing to speak to this matter. There appearing to be none, I will close the public hearing.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Thank you. Mr. Manius.
Thank you, Your Honor. Members of the court, if we could move to the briefing item, and I'm going to ask Dr. Tenay to come up and make his presentation at this time.
Good morning, Your Honor, members of the court. We'll go through our briefing for COVID-19 again this morning. Just to kind of catch you up, I want to first point out the graph at the bottom, the little boxes. Those are our testing numbers from our COVID testing.tarrantcounty.com. As you all recall, we opened some testing sites throughout the county in collaboration with the UNT Health Sciences Center, and also in collaboration with City of Fort Worth and City of Arlington. And it's going pretty good. We have over 3,000 this morning people that were screened through the website. And I looked at the data this morning. It was over 1,100 that have secured an appointment. And there have been about 560 that were qualified for appointment but chose not to get one. And we're doing a little survey with them, just a random phone call to see what might have caused them to not get an appointment. Is it locations? Is it hours? What may have been the cause? So once we have that, we'll try to address those as well. And then about 1,300 or so were screened and given reassurance that based on their answers, they were not at this point qualified to get a test, but they were given information since they were worried about COVID-19 on what they need to do in terms of prevention and how to make sure they take care of themselves and what to do next. And that information actually was a link to the CDC website, to certain guidance pages and so forth. And then in terms of total numbers, just to get you situational awareness for Tarrant County, this morning we'll be announcing that we have 2,687 total cases. That's a new number of 63 added to our total counts. 83 deaths. That's 6 new deaths added to our counts. 653 recoveries. That's 2 new recoveries posted for today. And I'll try to skip the global and Texas counts because we have more information to cover for Tarrant County. So what is our Tarrant County data showing? Last week we were kind of mixed indicators. Some things were flat, some were declining, some were up. Unfortunately, things have kind of not looked good this week. We've seen COVID-like illness starting to trend up for the last couple of weeks, and it's become a little bit more obvious. The graph on the right is a sort of a comparison with influenza-like illness. The blue line is influenza-like illness. As you can see, that's been coming down seasonally. And this is a 7-day moving average of those to give you a more smoother trend to see. And then COVID-like illness has been trending up for the last several weeks, but really just the last 2 weeks are what we would be looking at for a recent trend. Case trends, similar situation. Last week we talked about how the trend had been flat for the last several weeks, but we were starting to see a little bit of an uptick. Well, now it's become a little bit more obvious. If you look at from the beginning, and then the first 5 or 6 weeks were pretty flat after we took a little bit of a jump up. The moving average was showing a flattening of the curve, so to speak. But the last week or so, we've seen an uptick, and the numbers have jumped up. And you all remember the heavy reporting week that we had. This data kind of takes into account a lot of that. Now, the most recent 8 or 9 days, I wouldn't put too much stock in what's happening there because that data still, is not yet fully reported and things like that, because these are based on specimen collection date. So somebody has gone to the doctor, gotten a test done, all reporting may not be completed from a lab standpoint. So it is a little bit worrisome that we did see a uptick in cases instead of staying flat or going down. Death data, I've zoomed out to a weekly view. Pretty flat. I mean, last week or so had a little bit of an uptick, but overall, generally, you can see that once we kind of climbed up, we've leveled out at that level for a weekly basis. Hospital trend, another concerning trend emerging. We're seeing more people in the hospital with COVID-like illness. These are lab-confirmed cases. The low that we saw was April 13th. And since then, we've seen an increase in cases. I think on the low day, we were 113 people in the hospital with confirmed cases of COVID-19. Until recently, I think we were up to like 230. We're coming back down over the last couple of days. But the trend, if you look at a smoothed out trend, it's pointing up. On the right-hand side of the two lines, the bottom blue line is occupancy with COVID-19 confirmed patients. So this is for total bed capacity available. We have about 4% that are occupied with COVID-19 confirmed cases. The red line is more an indicator of all the occupied beds, what's happening in the hospital with COVID-19 cases, and we're at about 8%. But the real story here is to look at the trend. For the last 2-3 weeks, again, since April 13th, it's been consistently up. It's not actually, going down, it's trending up. So why do we worry about all of this, and why do we urge caution when people are, trying to go out and get back to normal? Because history has shown us repeatedly through various pandemics, but the biggest example being the 1918 pandemic. We see a spike, a lot of restrictions are put on, people cooperate for 3 or 4 weeks, and then people start to get complacent. And as we talk about, easing the restrictions and things like that, we need to be very, very cautious, do it in a very gradual phase like we're trying to do. But it requires the public. Just because we're being allowed to do something doesn't mean we as the public should not take protective measures. It requires the public, and the word from 1918 was they rejoiced in the streets. Right? We don't need to be doing that. Do not go out unless absolutely necessary, because if you see the first peak occurred, then there was a period of decline and flattening, and then the second peak caught everybody by a huge surprise. So the takeaway messages really are that we need to continue to stay home. That's our best strategy, unless you absolutely must go out. And social distancing is still the best tool. In the absence of that, definitely wear a mask. When you go out, it protects you and protects others. You might be coming down ill and not even realize it. And then seniors over 65 definitely need to continue to stay at home and minimize contacts with others, because we've seen in our data that they're getting disproportionately impacted, death rates higher in the older age group. So those are some of the key messages, and this is a reason why we get very cautious and remind the public to take all the precautions as we try to reopen the economy. We still need to be doing the right thing and follow these measures.
Yeah, I would again just point out, and I really want to emphasize what Vinny just said. Regardless, if you're outside, if you're going into a big box store or something, you ought to be wearing masks. I was very disappointed this weekend, and I was in a Walmart store, and many folks, it actually seemed like there were fewer folks wearing masks on Sunday than there had been the previous weekends when, we were still under restrictions. And I just want to echo what you said. We are beginning to lessen the restrictions. I think that's appropriate given the number of available beds. We have, from the very beginning, said the focus was on making sure that our hospitals stayed open, and we've been successful at that. But when we're out, we need to be wearing masks. We need to be maintaining the social distancing. And we do that not because, it's not infringing on my freedom. It's protecting folks around me from me, and it's being respectful and responsible for the older adults, for folks with underlying health conditions. And I just can't stress enough that when you're out, do that. Continue to wash your hands. Continue to not be in big groups of people gathering together. This is so important. As you said, we've seen some low numbers the last couple of days, but we can't celebrate in the streets.
That's right.
But I think we can get out and we can do that, but we need to do it responsibly. And that's not just getting out there and saying, by gosh, you're not going to be able to tell me what to do. We're not telling anybody. We're asking them to be respectful and responsible for others. So thank you very much for that.
Denny, could I ask you to speak to what seems to still be a rising number of cases in institutional settings, in the federal prison, in our county jail, and in nursing homes and retirement centers across the county, where people don't really have a choice about whether or not to be there, and social distancing may be difficult to accomplish?
Yes, sir. Commissioner, that's a good question. As you are aware, we're starting to face a lot of facility outbreaks, and some of those are in long-term care facilities, nursing homes. Some of them are in jail settings. Some of them are in other, aggregate settings, if you will, where people, are in large numbers. And, as you had that conversation last week with us about, what is being done, we have a plan now on how to address these. Of course, the governor's plan helped with some of that, effort. We've gotten some help from Health and Human Services Commission. They've mobilized some teams to provide testing. So over the last 3 or 4 days, there have been at least 3 facilities that they've helped us with testing. And we formed a new partnership. Long-term care facilities, yes, sir. And we formed a new collaborative partnership with City of Fort Worth Fire Department. And this partnership's, got other members. We've got MedStar, we got our own public health team, coordination with DSHS. And today, we'll be actually sending that team out to do testing at a long-term care facility. But it kind of is going to be a balance where HHSC is more regulatory for these long-term care facilities, so they're going to be addressing and helping address some of those outbreaks. It frees our resources between us and the city to address other facilities like a drug rehab place or a jail setting and things like that, where we can sort of divide and conquer, if you will, and get most of these places tested as appropriate. So that's one issue about that. And then the second issue is really facilities are congregate settings. It's very hard for people to social distance from each other. So at the first sign of trouble, these facilities do need to institute very, very strict social distancing and infection control measures. Our jail is a good example. I mean, they have done a great job trying to isolate people at the very beginning. Now, is the outbreak growing? Sure, it's still growing. It's the nature of the disease. It's very easy to spread. But they have taken very strong measures trying to isolate inmates, trying to isolate even officers who might be, taking care of those inmates or guarding them, and into separate areas where you can separate the well from the obviously ill. But the disease does spread, sort of without warning. So that is the case in a lot of facility outbreaks. I mean, we're seeing that in long-term care facilities and other jail settings. You've heard about the Federal Medical Center. They're dealing with a similar issue, large number of cases that just happens.
And let me make this comment about the long-term care facilities. I know we've kind of looked at that and said, oh boy, what are they doing? understand that the employees and the workers in those facilities are being dealt a very tough hand. You've got older adults and underlying health conditions throughout those facilities, and so for them, you know, they're heroes also. Those employees, those staff folks are out there and they're doing the best they can, and they're the ones that are serving the most vulnerable people that we're saying, you know, as we've said, that we're really trying to protect. But many of them are, you know, they're fragile. And these folks are doing everything they can. I mean, I was talking with one the other day, and they basically said, you know, we've stopped serving meals in our dining hall. We hand deliver to every one of our patients. No visitors. She said it's a very tough time for our residents because they're not, you know, they're used to at least being able to communicate and to interrelate with folks, and they're not being able to do that, and they are very vulnerable. So our first inclination may be, well, what are they doing wrong? Probably what we ought to be looking at is what they're doing right, because it is such a vulnerable population, and these employees are just working very, very difficult situation, and so we need to appreciate them also from that standpoint.
Absolutely. I don't disagree with everything that you said here is absolutely true. These folks are working real hard, and I'll tell you that majority of the time when our teams are out there or talking to them on the phone, they've already implemented the best known guidance that they have, you know, and they're getting guidance from everybody, right? Health and Human Services Commission, CDC, local public health, state regional office. They're trying the best to accommodate every single piece of advice that they're being given.
A lot of Monday morning quarterbacks.
And federal facility, I mean, you all have heard, they're getting even multiple federal entities telling them what to do. So, I mean, they're really trying hard to, you know, get things under control. Yes, sir.
I recognize that everybody is doing the very best that they can under very trying circumstances. But the fact is the numbers are still going up, and we need to focus on what we can do to try to bend that curve. I am certainly not passing out any blame this morning. I want to focus on the problem.
Yes.
And see how we can assist in solving the problem.
Yes, and it's a tough one. I mean, I agree and I understand what you're saying. But the reality is, like the judge said, it's a very vulnerable population at a higher risk in our community, probably the highest risk, being in a long-term care facility or in another congregate setting. And that's the reality. And these outbreaks don't really, you know, they occur, and we can do early testing like we're starting to do, early isolation at the first sign of trouble, good infection control practices, and good, you know, common sense measures. They still occur. That's the unfortunate part. It's, you know, there's no guarantee that one step is going to stop it, but we can do our best to slow it down and see how far we can get and succeed with that.
So, Vinny, could you speak to any progress we've made in being able to test the staff that work at these federal facilities? I know that that's somewhat of a complicated issue, but I think that's one of those important steps.
Yes. So we've had several conversations, and that offer is on the table. We have not yet heard a confirmation. I think it's being worked out through their union, through their collective bargaining folks on where the testing will occur and when. But the offer's available to them that we will provide that testing either through public health or through collaborative partnership with the City of Fort Worth, because the number could be large. We're talking several hundred employees here. So we might need multiple teams trying to address that. And what I've also been told is that they have their own medical folks available, so we might be working with them, but yet no firm date has been set.
I will tell you that there's a nursing home organization that has like 29 different facilities within this, I think 23 in Texas, 6 in Kansas, DMG, and I talked with their CEO yesterday. He indicated that they're testing all of their residents, and that's the baseline, and then even whether they've got symptoms or not, they will then turn around, and if they develop symptoms, then they'll retest those folks. Their employees, they're testing every other week. So they've got one group that they test 1 week, and then the second week they test another one, and they're doing that continuously. Again, regardless of that, they have already instituted the practices. I think most of them have now, where they will not let an employee who works at one facility work in another facility. They've limited it to, and I think that's CDC's recommendations now and guidelines too from that standpoint. Right. So again, I think they're looking at what they can do to try to, maintain control over this, and they're doing all that testing on their own. They're not, they're bringing in their own folks to do the testing.
And I was going to say that's a good model because, public health departments can address outbreak scenarios. We can't be their sustained testing partner. And the risk, and that's why we were very hesitant in the beginning to go test everybody at a facility, because you've got 2 cases and then the facility census, including staff, might be 200. Now you've tested 200 people, and most of those, 198 of those are asymptomatic. That does not clear those folks, okay? And that's very important to understand. So that, concept that the judges, talked about on a routine basis, they're having to test their staff. It gets very expensive and very resource intensive, but for those facilities, that could become the cost of doing business. But from a public health department standpoint, when we have the entire community to worry about, we can't become their routine testing partner. We can address an outbreak, but then they got to make it their routine part of the operation to catch any changes, what may be occurring, because asymptomatic people are not cleared because they're still in that facility and may develop the disease later if they've been exposed. And that kind of routine testing down the road every week or so might be a viable plan for the facility to try to catch things early and take preventive measures.
Thank you, Vinny.
One thing that I had asked about last week and has been addressed is making sure that we increase accessibility for our residents who English perhaps isn't their first or preferred language. And so I know that we've updated the coronavirus website with information in Spanish and Vietnamese, and that folks can call. So I'm just sharing that so that people know that that is there. I would like to ask about with our, with case characteristics and cases by race and ethnicity, that for Asian, Pacific Islanders, and American Indian, that those numbers are really low. And I just want to make sure that that's not an outreach issue. If those numbers are low because it's less of an issue, that's great. But if that's low because people don't know that testing is available, or they don't, they can't access it, then I'm very concerned about that.
And that's a great reminder. Through all of your offices and any other opportunity we get, covidtesting.tarrantcounty.com is the website, and we have a lot of capacity right now, about 425 appointments available per day, Monday through Friday, and they're not all being consumed, so we're not running out. In fact, we've seen a little bit of even though we tested more, we've seen a declining trend in the interest of people trying to go to the website. So anything you can do to promote testing at these locations, we will take all the help we can get.
I really want to make sure everybody just heard that. We've said we need to do more and more testing. We've set up the website covidtesting.tarrantcounty.com. We actually have appointments that were available and not filled. And so please, everyone you talk with, if they mention that they're interested in being tested, go to the survey, go to that website, fill out the survey. If you're, I know that we started out, we were only doing those folks that were at the high priority for CDC, and we've now moved that down. So please do not hesitate to go to that website if you feel like you may qualify to be tested. And let's make sure we use up all those slots on a day-to-day basis.
And that brings up something that I want to announce and emphasize, and that is that this afternoon at 2 o'clock, a new testing site will open in Southeast Fort Worth. It is one of the University of Texas Health Science Center, UT Southwestern, Tarrant County testing sites. It can be It is located in the heart of Southeast Fort Worth. This is an opportunity for people who may have found testing to be inaccessible before now. Now there is a site in Southeast Fort Worth, and the way you access it is through that website.
COVIDtesting.tarrantcounty.com.
COVIDtesting.tarrantcounty.com.
All right, thank you.
So, to Commissioner Brooks's point, and I just want to reemphasize, obviously, that we are still working to increase testing because it's a big county, a lot of people. So I don't want for anyone to think that it's stopping there, that we continue to look at that.
Absolutely not.
Yeah, okay. So my last question is just kind of as a follow-up to last week and what the governor had put in his plan about increasing capacity for tracing. Is there any update on that? Because we know that that's key to testing, tracing, isolation.
Yes, Commissioner. We've had at least two large group phone calls with Department of State Health Services because there's the one rolling this out. We believe they have procured a Salesforce contract with Deloitte, the consulting firm, that's building that contact tracing app for them. And it's a sort of a full solution like we have. You know, they have a testing website that's going to be rolled in where people can go and get screened for testing, and then they will connect it to statewide locations that are available as testing options. Ours is connected more to what the county has been able to collaborate on. Theirs is going to be more of a general statewide map. Here's all the testing locations that they know of. And once you get screened, okay, you can go to one of these locations because you're qualified to get a test. And part of that is going to be then also that once local health departments, get that information and a contact tracing effort is made, we can either partner with the DSHS to help with contact tracing, or we can enter that information onto the state website. So it's becoming a centralized solution. And they did tell us that they have about 1,100 or so trained personnel within the state health department and through various partners. And the goal is to grow that to about 4,000. Of course, we're pretty decent sized health department, and we've been doing contact tracing, but a lot of smaller health departments, 5, 10 staff, they don't have the capacity to do this at a larger scale. So that's where this is sort of coming in. We're yet to see how that works. They promised us that the first look will be available on May 15th. So we're waiting to see how that rolls out, and our goal is to let our systems that we're using plug and play with theirs, so staff don't have to do double data entry and things of that sort. But it's yet to come.
So we're still utilizing the UNT, some volunteers from their organization?
Yes, sir.
We've got 60 students from their school.
That is correct. And that number is growing. Yes, sir. All right. Thank you.
Now we have some public. We're going to do Guidehouse first.
Let me, if I could, Your Honor. We've got a series of presentations. Plus, I believe we have 6 or 8 people that want to call in. I think what we would like to suggest as we go through this morning is that, first of all, before we hear from the those individuals that are going to call in, we want to talk a little bit about Guidehouse. Guidehouse is a corporation that we have a consulting agreement with. The court did that last week. We've been meeting with them. We had a kickoff meeting last Friday, and then we had a staff meeting with them yesterday. And so what I would like to do before we go into the audience participation, Your Honor, is I believe that we do have Guidehouse on the line, and I would like for them to make a small presentation to you for several reasons. First of all, I want you to get to know them. Second of all, we're going to ask them to reach out to each one of you individually within this next coming week or so that you can not only get to know them, but also they need to talk to you about some of your ideas as it relates to how we might address some of the funding issues that we'll be talking about. And then finally, Guidehouse is going to be used as an internal resource to us. They have an extensive amount of experience doing this type of activity. They're currently with Harris County. They're not only are they doing the Harvey distribution of funds, but they're also contracted to do the CARE Act. I believe yesterday they signed an agreement with Cook County, Illinois, for the CARE Act also, and I believe Travis County is going to be utilizing them. When we heard their discussions and presentations and kickoff meeting last Friday, it was this is a good group, and this is a group that we're going to need, because they're going to help guide us through this process and also help us work through the different funding streams, which is something we're going to be talking about a little bit later on this morning. So let me ask either Lonnie or Megan, do you have Guidehouse on the line at this time?
Good morning, GK. We are on the line.
Okay, very good. Would you introduce your team and who's going to make the presentation today?
Absolutely happy to introduce us, and this is Rob Reed, and I'll be leading the presentation. We have several others on the line who I'll introduce as well.
Okay, Rob, I'm going to turn it over to you. Then just tell us when you're ready for us to advance the slides, okay?
Yes, sir. Thank you. So good morning, members of court. Thank you very much for your time today, and we really appreciate this opportunity to present to you. I unfortunately can't see what you're looking at, so I'm going to refer to our 5 slides by slide number and the content on those slides. So we'll just start with slide 1 with the Guidehouse team and pictures. Like GK mentioned, I just wanted to spend a minute introducing our team so that you know who we are as we move through this process together and with your team. So I mentioned my name is Rob Reed. I'm a director with Guidehouse and a leader in our disaster recovery and resilience practice. I've been working with communities recovering from significant natural disasters and crises for most of my career, really focusing specifically on leveraging federal, state, and local recovery funds to most effectively benefit communities. Then moving on to Todd Hoffman, who is Guidehouse's engagement partner. He leads Guidehouse's Southwest market and specifically our work in the state of Texas. And his role is really to provide overall engagement, executive strategy, guidance, and direction for our work with Tarrant County. Gaurav Menon, who you can see in the bottom left, is Guidehouse's federal funding strategy leader, and he will be providing direction to the team really on the interactions between funding sources, the uses of those funding sources, and how to maximize federal funds for the county. Brooke Barber is the project director, focusing on providing direction to our work streams and efforts and really overseeing the quality and the work of this engagement. Katie Chesson is our day-to-day project manager, and she'll be managing the tasks of our team on the ground and ensuring that rapid progress is made. And she is going to be our team's primary point of contact between the county and Guidehouse teams. And then Rachel Summer is a senior consultant who will be performing much of the work on the ground, our day-to-day work on the ground with Tarrant County stakeholders. So with that, let's go to slide 2 and just and I'd like to talk through kind of a high-level description of our approach in working with Tarrant County. And just if somebody could please stop me if we're not on that slide, I'd greatly appreciate it. But on slide 2, before we kind of jump into the scope at a high level, I wanted to really talk about what we've heard from the county based on our discussions with GK, Lonnie, and several others over the past few days. So we understand that Tarrant County has a few main and immediate priorities, and those are identifying and applying for all available sources of funding, leveraging those funding sources to maximize the county's recovery and financial position, and making rapid progress to help your communities. So in light of those priorities, reviewing this 90-day sprint with the county in 2 main phases. The first phase is really focused on response. And with response, we've included an activity for strategy and funding and another for technical assistance. And I'll briefly hit on what those mean to us. So within the strategy and funding phase, we're going to be focusing on a few main activities collaborating with the county team. One of the main activities immediately and really throughout the entirety of your recovery will be focusing on identifying and applying for funding opportunities. But this is really going to be particularly important during this upfront strategy phase, where a lot of the direction of recovery is being set and discussed. We will be jointly developing and agreeing on cost capture and lost revenue calculation methodologies. So how are we identifying and capturing those things, and what's the right way to record them in the long term? We will be identifying funding eligibility requirements and matching costs incurred by the county to those requirements. And then throughout all of this, we begin to capture eligible, actual, and projected costs that you're expecting to incur. Then, still in our response phase, under the technical assistance bullet here, we'll be identifying required reimbursement documentation, collecting and organizing that documentation with the county staff, and then monitoring grant submission and award progress as we go through this process. Then we move to phase 2, where we're really focusing on recovery and specifically thinking more about the long-term success of the county, how you want to spend your funds, how you're going to manage recovery projects. So within that first chevron of recovery project management, we'll be developing a project management governance structure and standing up that PMO and all of the activities and sub-processes that go along with it. Then under compliance, our main focus here will be working with the county to evaluate grant risk areas and implement controls to reduce that risk. And the key to these activities being making sure that any funds that you receive from federal, state, and local funding sources stay with the county with no de-obligations. So this has just been a very high level of our high-level overview, I guess, of our focus in working with the county. What I'd like to do is move to slide 3 to talk in a little bit more detail about timeline. So on slide 3, we have a timeline for the first 6 weeks of our work with the county. Before highlighting a few key items that I think are particularly relevant to this group, I just want to mention that we very much feel and share in the county's urgency and really understand that that time is of the essence. And our intent in our primary effort is going to be doing everything we can to move through these steps as expediently and quickly as possible, but not at the expense of quality. Because we want to make sure that we are accurately capturing and documenting costs and are able to maximize reimbursement to the county and not leaving anything on the table. So in this timeline, we've already conducted our kickoff, as GK mentioned, and we're most immediately focused on activities 2, 3, and 4, where we will be reviewing the county general ledger, summarizing expenditures, and then ultimately starting to bucket those expenditures or group those expenditures into big buckets according to the different funding source requirements. Once we have a better idea of what expenses the county is incurring and kind of conceptually where they fit in terms of funding source, we'll be focused on activity 6, which is understanding the unmet needs that still exist within the county after we have aligned expenditures and costs to the different funding sources. And then during all of this, we'll be formulating an initial FEMA project worksheet. That's a very ongoing process, submitting a FEMA request for public assistance, which is kind of a background or administrative step to requesting that initial FEMA funding, and then substantiate costs, which you'll see at step 7. And then towards the end of the timeline in step 8, we will be conducting strategy workshops with county staff to really nail down the county's intended use and strategy for federal funds, and then confirming those details with stakeholders. Then finally in step 10, submitting our PW or project worksheet version 0, as FEMA calls it, to FEMA and to the state, to TDEM, and finalizing a first version of other recovery projects as they're identified. So then on to the next slide, slide 4, please. So here on slide 4, we wanted to provide a visual of our approach to bucketing federal funds and the county's expenditures, especially given the numerous complexities of the CARES Act and the other funding sources that the county will receive. This is also with the understanding that federal funders are rapidly developing updated guidance specific to these unprecedented circumstances and all of the eligibility requirements and allowable uses of funds. So this guidance is kind of changing and morphing on a daily basis. So as we go through the process of identifying expenses and costs, identifying grants, and then matching those expenses with the different eligibility criteria, we'll basically start to build out a portfolio of different sources of funding and aligning those different funding sources to the county needs. This graphic is also one way we're intending on reporting out to this body. So as you see here, we've grouped a lot of the smaller grants coming from the CARES Act into one bucket on the left, the multiple small grants, as you can see. FEMA public assistance into another, and FEMA public assistance is going to be one of the more immediate funding sources that the county will be receiving, and that we'll be working with your teams to identify and capture costs for. Then we see donations in a third, coronavirus relief funds into a fourth, and then finally any other future federal grants that we're anticipating the county to receive.
Rob, when you talk about donations, is that donations that we're making, or is it donations that are being made by other individuals?
Yes, sir. So that's donations being made by individuals to the county, and capturing those donations and accurately documenting them is actually really, really important, especially in the context of FEMA public assistance, because FEMA funds come with a cost match requirement, basically meaning that FEMA will pay for 75% of the eligible costs that we identify. That other 25% is the responsibility of the county to pay for, but we can actually use donations to, for all intents and purposes, increase the federal cost share or offset the local share of FEMA funds. So as we go through this process, we'll be capturing those donations and then aligning them to the different eligibility criteria that fall under donated resources, to use FEMA's terminology, to hopefully offset the local cost share as much as possible.
Thank you.
Yes, sir. And then on to slide 5 here. And this is closely tied to the information on the previous slide. We'll be working with the county to basically identify and track the different projects and initiatives that each of the funding sources you receive will be used for. Some of these are more prescriptive in the way that you use funds. So going back to our example of FEMA funds are primarily used to reimburse the county for direct costs that you're incurring as a result of COVID-19 response, and with a number of different caveats and eligibility requirements in there. Other funds, however, are able to be used in much more flexibly and to kind of to prepare the county for future disasters, for resilience initiatives, other projects that may be tangentially related to COVID-19, but may not be projects that you're directly incurring costs for. So we'll be tracking the earmarked funds, or funds that have been identified for particular use with a funding source. And we'll be tracking expended funds, or funds that have already gone out the door for a specific effort, project, or initiative. And then finally, the remaining funds that have not yet been programmed, so we can kind of understand where we can plug in county needs and make sure that we're maximizing all of these federal funding sources that the county will be receiving from CARES and other sources as well. So that concludes our formal presentation. Anybody on the Guidehouse team on the phone would be happy to answer any questions for you or take any feedback. And I just want to reiterate quickly, we're very pleased to be working with you and are excited to hit the ground running and make rapid progress as quickly as possible.
Questions from the court?
Just what's the next step? I mean, I saw the timeline, but this is more so for GK.
So, yeah, first of all, the timeline is a tentative timeline. We wanted to show you the processes that we're going to be going through. What we're going to do, we're going to go ahead and have Guidehouse reach out to each and every one of you this week to get some of your input as far as different programs. Today, we're going to also talk about a couple of different programs and the funding sources and things like that. Just a couple of things that as we go through this, I know, Judge, you want to go ahead and move to those individuals who want to call in, but there's still a tremendous amount of uncertainty as to what the CARE Act funds can be utilized for. In fact, we had a lot of questions yesterday morning last night, Treasury released some additional guidance to us, so we're working through that. Our goal is to make sure that whatever programs we do fund, that we are eligible for reimbursement. And the one good thing that Guidehouse, one of many things that Guidehouse brings to the table, is that their philosophy is that we should look at a series of federal funding sources, and the CARE Act should be the funder of last resort on those programs. For example, if we look at rental issues and housing relief, CDBG has received some additional monies, and the City of Fort Worth, City of Arlington have also received some additional monies for rental relief, so that we don't create a new class of homelessness out there. Things like that. You heard Guidehouse talk about FEMA, and FEMA is not the CARE Act necessarily. It's a different funding source that those monies are there. So that's what we'll be working through. Today, after we get through with the audience participations, I want to walk through several items with you all as far as what you all see as our most pressing needs that we need to address immediately. We have suggestions, but that's going to be a decision that the Commissioners Court makes. We have already started expending some of the CARE funds. I'll give you a good example. We have ordered 1.5 million masks, the surgical masks, and we have made them available to our local jurisdictions, and we've already disseminated, I believe, 600,000 of those, and intend to disseminate even those masks even more. We've kept a large stash of those masks for our internal uses, things like that. So we're beginning to do some of those expenditures. And I don't want to get too far in front, but testing is going to be critically important. Economic impact is going to be critically important. Housing is going to be critically important. So we want to have some conversations with you. So as Guidehouse helps us with the financials and making sure we have everything in the proper rows and columns for funding, we're also going to be coming to you with some funding suggestions, and you all need to help us, and we'll help you work through that process. But that's going to be something that'll occur within the next couple of weeks. This is going to be a standing item. We've talked about this in court for the last 2 weeks anyway. This is going to be a standing item and a discussion item and an action item on our court until it's for a long time. I hope that answers part of your questions at least.
No, it does. I mean, and additionally, I'm just wanting to make sure that we're moving on things that we can move on, not necessarily in advance of what Guidehouse is helping us to do, but we have very real needs today, and the last thing that we want to do is, take any longer, than it's already taken, and mostly because of things that are out of our control.
Yeah, so just as an example, 2 examples. The testing that UNT Health Science Center is doing, we're funding that. The court entered into an interlocal agreement with UNT Health Science Center to do that. That's going to be a continual expenditure because our goal was to begin testing as many people as we possibly could. Today we're going to bring you a consultant contract with an individual that's going to help us in public information in the public health department. We have some other ideas that we're going to talk with you about in a little bit, but we are moving in. We're not standing still on this thing.
Sure.
It's just, and just as an example, the City of Fort Worth last week dedicated certain amounts of money for rental assistance and economic development. They're not ready to take that out to the public yet. They're establishing the tranches of money that would be available. Now they're working through the process of getting the stuff so that they can make the distributions. And we're doing the same thing, but we've got some things already that are out of the gate. And we talked several weeks ago about testing. And Judge, you've mentioned testing all the time. This court's mentioned testing, test. And Dr. Tanasia has also mentioned it. We're trying to push that out as much as we can so we can get as many people tested as possible.
And I'll tell you, one of the other things that I keep wanting to see if we can't do is to call all of the private sector clinics and such that are doing testing and see if we can get a number from them as the number of tests that they've actually done since the beginning. They should have record of that because they billed somebody for it. But
So-
that's one thing that I would like for us to do.
Now, we're trying to do that. We know they have to report that to the state. Excuse me. We're trying to get it broken down on an individual basis. It's more difficult than it might seem. But
Trust
we're
me, I
trying.
know that it's been like pulling teeth, and we still don't have it. So they're about run out of teeth for us to pull.
It shows my age, but there's no moss growing on these rolling stones. We're moving as quickly as possible.
I agree with what you're saying, and I think we are looking. I want us to begin to put some parameters down, or to at least indicate some dollar amount, because I think as Patricia and her group begin looking at the housing, the rental assistance, and things along that lines, it's not the landlords. If they hear dollars being mentioned, I think it brings them to the table a little bit more seriously because of that. I mean, the other side of that coin is we have to be very careful, because Fort Worth got a grant of about 158 million, and we got about between 209, 210 million. Ours may end up being primarily for the other cities within Tarrant County and some of the Tarrant County expenses. We're still trying to convince the state that the 1.8 billion that they got, that was at least implied to be going to cities and counties above 500,000. We're trying to convince them that they need to give that to us. So,
And we were going to have some of those conversations a little later on. We can have them now, unless you want to get into the telephone calls first.
well, I think I would rather do the telephone calls near the end of our conversation, so that the people on the wishing to call in can have the benefit of hearing what we're going to discuss before they make their comments.
Okay, so before we take any action items, we'll hear from them, but let us talk through some of these other things, if
Okay.
that's okay with you, Judge. So, we were going to do a presentation this morning on housing and evictions, and Patricia, I might ask that you come up now and do that. I've asked her to spend 4 or 5 minutes. Patricia's been leading a county-wide effort to talk about evictions, so we don't create this new class of homelessness. And she has been working with the apartment association. She's working with our justices of the peace. She's working with the different housing elements, and I've asked her to come and talk with you for 4 or 5 minutes and explain what we're doing. This is an informational issue here. So, Patricia.
Good morning. Over the last 5 weeks or so, we have been meeting weekly and daily. City of Arlington, the Homeless Coalition, Fort Worth, and Perry Pillow with the Apartment Association. We've also been texting back and forth and talking with our county clerk and our JPs, so to try to put together what the need and expenditures will be in about a month. There have been the evictions. We're still receiving those, and the deadline is May 18th. We don't anticipate seeing filings until the early June. At that point, right now, as of April 16th, there were 1,198 filings. And if you look at, we're calculating that based on $1,200 rent and for 3 months. But doing trending analysis right now.
$1,200 per month or $1,200 for 3 months?
No, $1,200 per month. That's the average rent in Tarrant County.
That's right.
So, and rental assistance calls to our office alone have surged to 189 just this month. In April, there were 68 calls. In March, there were 81 calls. We're trying to trend that also, but again, we don't have any experience trending a virus. So, but
we're 5 days into May, and what was that number?
I'm sorry?
We're 5 days into May, and what was the number so
For
far?
April, it's we don't have May yet, but for April, we have 189 calls. And we're also looking at unemployment. In March, Tarrant County had a 4.4 unemployment rate. For the new claims in April, there were 57,978 claims. So we're trying to blend all those together And we're looking at building stronger relationships with landlords. One of the issues here is on federal properties that have federal funding in them. We will not know about the debt that has not been paid on those properties probably till August, because there's a 120-day moratorium on federal funded apartment complexes. So we're talking a lot with our own landlords. We're building that relationship. We're talking to Perry. I talked to Perry twice yesterday just to get that communication going, so where we can bring the tenants who are suffering right now from unemployment to the landlords, and hopefully we can bring those together where they won't be evicted. It's critical that we talk to the tenants who can't make their rent before they are filed on. And it's critical that we talk to the landlords and work with them and the tenants. We are going to add another caseworker just to strictly work with landlords and tenants, and we're going to add an intern to take the phone calls. So we are ramping up right now. I know City of Fort Worth and Arlington are also ramping up, and we're moving forward together. And I'm hesitant to calculate what we think the impact will be, because once again, we do not have a trend analysis for this. But Fort Worth has put in a lot of money so far, and I'll sit down with GK and I'll go over those numbers and I'll share them with y'all.
What does Fort Worth put into the program?
I think 15 million.
15.
Mm-hmm. So, and you have to look at the demographics for each jurisdiction. We're looking at the jurisdiction outside of Fort Worth and Arlington, and most of the apartments are newer, and Fort Worth is a little bit older, so we're anticipating the trends for evictions might be a little bit higher in Fort Worth. But we'll keep tracking those on a daily basis, and we'll make sure that each of you are aware.
But in any case, we're collaborating with all those
Yes,
different
we are. I talked to Tammy.
cities and
Yeah.
agencies.
So on our CARES fund, we're looking at putting more money into shelters, because over the last 2 months, the shelters costs have skyrocketed. And we need to help them make themselves whole, because we still have a population of homeless people we need to take care of.
And I think that's where we need, and Commissioner Allen, Commissioner Brooks, if y'all could kind of work with the Guidehouse, because I think that's one of the things I think Guidehouse was trying to point out is that HUD money might also be able to be used for rental assistance. Mm-hmm. And the impression that I got from them is we want to be careful to use the money where we can. And so if HUD money is going to be dedicated toward assistance, we don't want to use CARES Act money, right, and then possibly not be able to replace that. So, again, because Fort Worth has their own pot of money for that, but I think you've worked with them, and then certainly the rest. Arlington is going to be a big player in that, as is Mansfield, and as a lot of the areas that you're going to be looking at. And so if y'all could kind of work closely with Patricia and with Guidehouse in that particular area, that would be, I think, a big help.
Yeah. Well, and I know that we don't have enough data yet really to trend, but if we take our entire county, I understand that about a third of our county are renters. Correct. So this is a huge issue that I know that we're working on. Even with the teletown hall that we had hosted last week on rent and housing, we had 40 questions that we weren't able to get to, so some of those are coming your way, Patricia.
Great.
We're transcribing those, but so it's a huge issue. So I appreciate all the work that's been done on it to this point, and look forward to being helpful as we move forward.
Thank you.
And one of the things that Guidehouse mentioned was earmarking. They had earmarked or actually have spent. And I'm assuming that between Helen and the auditor, y'all are keeping fairly good track of what we have actually spent. And then I think the other thing that what I heard Guidehouse saying was we also need to keep track of any volunteer donated hours, anything along that top lines, because that can also come to play when we get into this. But I would hope that, Fort Worth is earmarking, or at least tentatively earmarked 15, that maybe we look at least the same amount, and again, realizing that we're not talking about how are we going to get it out, but the fact that at least we might be looking at
at 15, and then that says to the landlords and to the rental folks that, okay, Tarrant County, Fort Worth, we're talking about some serious money. They need to come to the table and to begin talking about how that money might be and what concessions they're willing to make to not have to go through the eviction process and get nothing.
Yeah. Having been a landlord, I can tell you that it's better to keep the tenants you've got if you can than to go through the expense of getting rid of that tenant, making the apartment or house ready again for a new tenant, suffering some revenue loss throughout the process, and getting in a new tenant who may or may not be a good tenant.
Yeah.
Better the devil you know than the witch you don't.
Well, and this has been said, it's important that we don't increase the number of folks who are without a home.
Right.
Obviously, the operations at the convention center continue. There's a ton of collaborative effort on that. I know Patricia and her team are working with a host of folks on that. But it's, already the growing group of those who were experiencing homelessness were families. So I think it's important. There are many stakeholders in this. It is important that we protect those or help those whose business is providing housing, but we also protect those who need somewhere safe and clean to lay their head every night.
And Commissioner, you raise a good point, because the funds that are coming down through the feds through HUD are, they're the emergency shelter grants, and it's not just rental assistance. It's going in and helping, the night shelters, because we need to make sure that they stay strong, because we're just at the very beginning of this, and we want to make sure that we don't increase that population. So there's a couple other things that I want to talk a little bit about with you. It's been mentioned a couple of times, but I've already had conversations with the city manager of Fort Worth. And the city of Fort Worth understands that it's not just $158 million for Fort Worth and $210 for the county. They realize that this is a county-wide effort. And so we're going to be collaborating on all of these projects, because if monies are available and Fort Worth can inject their part of the CARE Act into Fort Worth, and we can use our CARE Act to use outside of Fort Worth, well then that's good for both systems, because we'll have a much greater impact. We talked a little bit about the funding allocations. We'll come back to that. I do want to talk about something, though, that's critically important. I think the governor is going to have a press conference at 2:30 this afternoon, and hopefully we'll learn more about what our other municipalities may be receiving from the state at that time. It's going to be very important that as we go through this, we need to fully understand that our local partners, our other municipalities, are experiencing expenses as it relates to this, and we need to be absolutely sure that we make our local partners whole as far as the expenses that they incur. This is not the revenue side of the ledger. This is the expense side. And so we're going to be working with them so that they're going to be suffering, you almost wouldn't think we would say this, but we're very fortunate that we don't depend on the sales tax at the county right now, because cities are experiencing a tremendous amount of revenue shortfall. The CARE Act does not supplement that revenue shortfall, so we need to help them with related expenses that they've incurred because of COVID. We talked about the testing aspect. One time I came before you and said we ought to at least dedicate $20 million for testing. I believe that's going to be something that these numbers are going to be shifting, but I think that that $20 to $30 million in testing, if testing is that important, we've heard that it is, that we need to make sure we fund adequate amounts of money for that. Social services, including housing, rent and utilities, those type of things, we need to make sure that we put an adequate amount of funds in there also. And then the economic impact, we have a lot of small businesses that are hurting, and we need to get out there and help those small businesses. We didn't know until last night if we could actually expend any funds from the CARE Act on those. We think we've got clarity on that now, and so we'll be looking at that also. Judge,
and we're talking about truly small businesses.
Absolutely. And
mom and pops and up to 10, 15, 20, 25 employees. Small business.
Yes, sir. And I believe that that's a decision that this Commissioner's Court needs to make. And as we go through more and more of defining and refining what the guidelines will be and the way we're going to deliver that service, obviously that's a decision of the Commissioner's Court. So you'll be hearing about that. Judge, those are the three big things that I see right now, besides the things that we're currently doing. And that is not going to consume, actually there's four things, because one of them is making sure our local partners are made whole. That's critically important. If the governor releases some money to these other jurisdictions, and we hope that they do, then what that will do, that will allow us to free up additional resources to plow into these other areas. Unfortunately, we don't know right now what the state is going to do. Hopefully, we'll get some clarity on that beginning today.
GK.
Yes, sir.
I had a reach out yesterday from Susan Garnett at MHMR saying that they had some extraordinary expenses due to COVID-19 in terms of purchasing PPE, some technology things that they've had to acquire, and some staffing costs that are related to managing persons living in their group homes.
Good.
And asking that they not be forgotten as an agency.
Absolutely. I mean, MHMR is a sister partner to this Commissioner's Court, and while I haven't spoken to Susan directly, understand that there's some personnel issues and some of these other ones. We'll definitely reach out to them. I know that we've gotten some requests from them already. And,
yeah, I have about a handful of requests that I think have been sent to your office, and we've been copied in. So
okay, if you do receive requests, if you'll simply forward that to, let's go ahead and forward that to Lonnie in my office. She'll be the collector, and we'll disseminate. All of our staff are really working on all this, and we'll disseminate that out. I know that Kristen is doing a lot of that outreach also, and we're coordinating that. So if you get a request, please send it in.
Sure. I think it's all kind of y'all's way, but we'll double check. But
okay.
Just wanted to clarify, when you talked about social services, you included rental assistance and some, I mean, that's a broad category. So that would include like the nonprofit organizations that are serving these critical roles, right?
Yeah, and I would think that we'd have to, this is the way I would suggest we look at it. We need to get a more clear picture as to the depth and the scope of this. And once we do that, and we're not going to sit around just simply waiting for all that, but to develop the programs that we can come and recommend to you all for your consideration, and have these continual discussions on those type of programs so that we get clarity, we get direction, and then we can create action.
You know, and I guess Commissioner Fickus and I had talked a little bit earlier about some of the small business stuff, and you know, again, Commissioner, to your point, really small businesses. This would be the barbers. This could be the salons. It could be the nails. It could be, as you said, the businesses under. What are you grinning at me about?
The nails.
The nails. Yeah,
they're not done.
I know. The hair's not cut. I'm ready to get to the.
It's in a bun.
But again, what I think we need to look at is, and Guidehouse will be a big help. I can be a big help in this, but I think we need to really begin to figure out how we eventually, and I know that GK has begun looking into methods of taking applications for and distributing money, and you know, we had talked a little bit about, maybe somewhere between 25 and 30 for small businesses. This morning we mentioned, housing. We mentioned around 15 to maybe 20 for that. The social services, which I see as being the food bank, which I see as being, some of those types, Meals on Wheels, a lot of those types of services could be another 10 to 15. And then GK, you had mentioned 20 to 30 for testing. And that's just, that's not setting anything in concrete. I don't think that's anything we take action on, but I think at least by mentioning it, we talk about, the landlords will begin to hear those numbers. And the folks, the small businesses will say, okay, there's going to be hope. There's going to be money coming to us. And from the very beginning, I think what we have hopefully, using that word just that way, we want to keep instilling hope in our citizens, that we're going to help them and that they're not alone in trying to recover from this. And so I hope that we can focus now while Guidehouse is trying to find other money. I hope that what we can use Guidehouse for is to also begin to give us some ideas, and we can begin to think about who might help us distribute the funds. I know the City of Arlington is talking about using some of their own grants folks, and I think those are the kind of opportunities we need to be looking at in the application process. And some of these entities have already, set up something. So, if we can steal an idea from somebody, that's all the better.
Well, I think one of the most important things that we have got to do is, and it really doesn't matter whether it's rent assistance, mortgages, it's helping the small business guy, it's helping the individual. Every week that money sits in the bank and is not in somebody's hands, that noose gets tighter and tighter.
I understand.
And we're not going to be able to help anybody if we don't get this money out absolutely as quickly as possible. If we're sitting here 8 weeks from now and we haven't put any money on the street, we failed. We failed big time.
You are absolutely right, Commissioner.
And
there is some urgency here.
Believe me, we hear you loud and clear. We're right there with you. We're right there with you guys. Two other things, and then I'll sit down and you can get to your calls, Your Honor. We need to make sure, and I think that Guidehouse and our other partners will help us with this, but we need to document our expenses, and everyone that we touch, they need to document your expenses so that they qualify for refunding, so that we can make sure that we stay within our various lanes. And I think Guidehouse is going to be good at that. The judge pointed out a little bit about something that Arlington might have a delivery system. We're not here to create a new delivery system if one is available. There's not a necessity for us to do that. If there's a delivery system that's out there in these municipalities, then we need to work with that delivery system if they have a track record of success and get that money out. That being the case, we have partners in this. Our municipalities are partners, and we need to make sure that whenever we do programs in the various cities, that we co-brand those programs, so that it's not just Tarrant County, but it's Tarrant County and the City of Arlington, Tarrant County and the City of Forest Hill, Tarrant County and the City of Bedford, things like that. These are long-term partners, and we're going to make sure that they get and they're working hard on this also. They need to get credit on this also because they're doing a good job. So with that, Your Honor, members of court, that was my presentation on this. I know we have action items, but I believe you want to take those calls.
One other question that I want to ask, and I had a little bit of a discussion with the auditor about this morning. Interest on the money that we've got sitting in the bank account. We got $209 million or $210 million, and even if it was only making 0.25% interest, that would be about $10,000 a week. I bet we could find a few people who might want to come up and apply for that money?
After you left my office this morning, I've spoken with the DA's office, and she understands the request. After that, even after I spoke with the DA's office, so we were still reading through some of the frequently asked questions that Treasury had put out, and we appear to have found an answer, but again, I'm going to rely on them, that says that we can invest the money. There are some guidelines, again, how to invest it, and it appears that it would be a first in, first out, because any of it that was left would have to go back to the federal government.
Trust me,
So,
there won't be anything left.
I understand. But anyway, we're working on that, and we hope to have a definitive answer soon. And when I do have an answer, I'll be getting with the bank in regards to what our options might be for investment. I would point out, if we move any of the money out into any of the funds, the investment funds and different funds, interest is very low right now, as you're all aware of, so there's not a lot of earnings, but also there is no collateral. If the money remains at J.P. Morgan Chase, it is fully collateralized, so that's the only other consideration there.
Well, they're collateralizing with Treasury notes, which are paying some interest rate, so if we bought Treasury notes, would be
right. But if we bought the
Same
Treasury
thing.
notes without a good spend timeline, I wouldn't know how long to buy, because again,
all I'm saying is that money has sat unused
that's correct.
for 3 weeks, so that's about $30,000, right? If we were making 0.25%.
Right.
And so my feeling on that deal is don't wait till next Tuesday.
No, we will have an answer soon. Hopefully today.
If you have an answer today, invest it tomorrow.
Understand.
Is Tex Pool still around?
Yes, Tex Pool, there's several of investment funds, pools like that, that we utilize year-round for the county's funds. Yes, they're all still out there. I'm just pointing out that those monies are not collateralized when they go in those funds, which, I'm not saying it's a concern. It's just that initially we put it in the bank and then J.P. Morgan offered up the collateral. Those are fairly large deposits on top of the deposits that we already had. We have a lot of money in J.P. Morgan, obviously. But we will move forward.
Thank you, Renee.
That's all of our presentation on this until we get to our action items.
Okay, so I'm going to begin the fun part of our meeting where we dial for comments. And our first comment is going to be from Joanna Cardoza. So here comes the phone call, I hope. Joanna, this is Judge Whitley.
Hi, how are you?
Great. You indicated that you wanted to make a comment today with regards to the COVID testing sites.
Yes, sir.
I'm going to ask you to repeat your name, and then you can make any comments you like. You will have 3 minutes to make those comments. So it's yours.
Okay, hi, my name is Joanna Cardoza, Arlington, Texas, 76017. Good morning, County Judge and Commissioners. I'm calling because I'm very concerned about the increase in and higher COVID-19 positive cases in zip codes in Arlington that are high minority non-English speaking communities and also have very limited access to the internet or lack of internet access due to the infrastructure. It concerns me that there is a lack of real conscious outreach to those communities. Putting videos on social media do very little for a community that has very limited access to the internet. Conducting telethons with valuable information is great, but does no good to communities that do not understand the English language. What our community needs is our county to provide testing in the impacted areas, especially due to the lack of transportation in our city. The Parks Mall is not in the most impacted zip codes. Testing sites are not good if people cannot get to them. We need testing that will create a real impact on our communities, not as a check to check off to reopen our businesses. We need real, deliberate outreach to the most vulnerable in our communities, which, mind you, are not only our older residents. We need to create a task force that are real community stakeholders to come up with a strategy and for outreach. Our county message needs to be one voice, one message. The vulnerable in our community are our older residents and African American and Latino residents. The City of Arlington's testing data reflects this, that currently these three populations are the most affected. 3 of the 6 deaths in Arlington have been from the Latino community. Our communities cannot afford to wait in line for a testing site. My mother cannot wait. We need our leaders to follow the data and create a strategy to fight this based on data. We also need the data for on the county website to be easier to access, such as cases by zip code. It is very difficult to find information on the county website, even as an English speaker, so I can only imagine what our non-English speaking communities are having to go through to find that data. Especially, there's a lot of requests for information by zip codes, and I think that's one of the hardest ones to find. That's the end of my public comment.
Thank you very much, Joanna.
Thank you, sir.
Have a good day.
You too. Bye.
Any comments? Okay, the next is Emma Jones. I'll be giving you a call, Emma.
Hello.
Hi, Emma. This is Judge Whitley. You had put in a request to speak in regards to the COVID-19 activities, and so I'm giving you that opportunity. Please repeat your name and address, and then you have 3 minutes to make any comments you wish to make.
Thank you, Judge. My name is Emma Jones, and my zip code is 76123. In the wake of a global pandemic, some progress has been made in other counties to cancel their 287G agreements and reduce incarceration in order to protect people from the clear and preventable risk of spread within incarcerated settings. Some progress has been made in Fort Worth, but not at the scale we've seen in other cities. Tarrant County jail population has dropped less than 10% since the end of February, compared to a 30% drop in places like New York or LA, and a 35% drop in San Francisco, and a 39% drop in Detroit. The 287G program is once again up for consideration for renewal in June of 2020. The coalition, ISAT of Tarrant, believes that it would be the best interest of residents of Tarrant County for the Commissioner Court to vote unanimously not to renew the program. This program promotes racial profiling, inhibits people's rights to due process of law, and is overseen without empirical data and flagrantly lacks research-informed decision-making. Sheriff Wayburn insists in 2019 that the program costs roughly $1,800 a year to administer. However, as Commissioner Ray Brooks stated, other counties with similar population sizes to Tarrant County were budgeted between $600,000 to $1 million per year to maintain. When Commissioner Brooks questioned Wayburn as to how Tarrant County maintains such a low administrative cost for this program, the sheriff could not provide any evidence to prove this claim. Sheriff Wayburn insisted in 2019 that it's helping, this 287G agreement program is helping Tarrant County to maintain a safer community. However, when questioned by the commissioners as to how this is so, Sheriff Wayburn could not produce any empirical evidence to affirm his assumptions. So here we are, in a place where our humanity and our compassion needs to be at the forefront of every decision we make. But instead, Tarrant County Sheriff Bill Wayburn has yet to put what is good for public health over the allegories of outliers. 287G is a wasteful program in regards to county resources and efforts. The coalition ISAT of Tarrant believes any and all resources being funneled into this basis program based on racist beliefs should be redirected to county resources to fight COVID-19. Thank you guys so much for your time. Thank you for everything you've put together today. And I look forward to speaking to y'all next week.
Thank you. Goodbye. Since that is really a 287G and that is not on our agenda, then we can make no comment with regards to that particular item. Next will be Cynthia Mancha. Okay, somebody want to guess as to what that number is?
1436.
1, okay.
Good guess.
No, we're going to stop that, and we're going to start this over again.
Cynthia.
Hi, Cynthia. This is Judge Whitley. You had expressed a desire to speak on one of our court items today, and so if you'll please repeat your name and address. You have 3 minutes to make any comments you wish to make.
Yes, sir. Good morning. Thank you, Judge Whitley, and greetings, peace and greetings to the Commissioner Court. My name is Cynthia Mancha. I do live in Euless at 76040. I do represent through an organization called Build a Better Hood. I am the operations director, and we are based on the west of Fort Worth. My concerns today have nothing to do with that. My concerns today is, this pandemic has been pretty surreal to me. Although taken very seriously, it hasn't really hit home until my stepdaughter actually, with flu-like symptoms, went into the hospital and tested positive for COVID-19. She is asthmatic with underlying conditions. She was, a single mother with a 1-year-old, and she works at Amazon. My concern that hit me in a couple of places yesterday that were very discomforting was, one, the fact when she went to the hospital, her 1-year-old and the father were told to leave, even though they all live together. They were told to leave, and I'm really concerned about the fact that no open testing was offered or even available for them besides them leaving, because obviously they've been in contact with her. Obviously, they're now out and kicked out of the hospital to go wander around. And I'm wondering, why is there not an isolated section of the hospital where potential, people who have been in contact with COVID-19, like family members, can go to where they're not infecting or not endangering themselves or others, or becoming, or running the chance of being contracting it just by being there in the waiting room, but an isolated section to where they can be tested on the side, and then, of course, either with knowledge, either released home to be isolated or quarantined, or know that that's what that they have. I know everyone has to take their their proactive precautions anyway, but for her coming up positive yesterday, she didn't know. She could have been walking around with this for 2 weeks. Amazon released a statement on Friday saying that another coworker had become tested positive, and their last day was the 18th. They didn't release a statement until Friday. And I understand contact tracing is very effective in a lot of cases, but in a place like this warehouse where they come in contact, with hundreds of other employees, why not target set a target out to where a team does go out and do mass testing in that site? Because right now, hundreds of people could be walking around asymptomatic and infecting others, going home, infecting their families, and then during this 13 days that Amazon took to release the statement, they could already infected hundreds. And now we know there could be more there that are sick. We just don't know because they haven't did mass testing. And yeah.
Cynthia, that concludes your 3 minutes. I guess I'm going to make a couple of comments. One, I would encourage the two that were asked to leave the hospital to go to our public health site at covidtesting.tarrantcounty.com and fill out that survey, because from what you're telling me, if they've had any symptoms at all, my guess is they would qualify for testing, would be given an appointment and a location to go to probably as early as tomorrow from that perspective. So that's one thing I would encourage you to do. As far as the hospitals, those are really procedures that the hospitals have put in place, but I will tell you that I don't know what hospital they went to, but I will tell you that's not uncommon. For the most part, hospitals in this area are not letting anyone visit and or enter their hospitals unless they're there to potentially be admitted and or tested and then admitted. So, but again, that's left up to the hospitals and not something we have any control over. But I would go to that covidtesting.tarrantcounty.com and fill out the survey, and I think based on what you said, there's a very high degree of likelihood that both of those individuals would qualify for testing and could get that testing done maybe as soon as tomorrow.
Can they qualify based on just the fact that they are in close encounters with a person who had just tested positive, and let's say their symptoms have not kicked in yet, but just on the fact that they've been in contact, living in close quarters, with the infected person? Is that a qualifying criteria?
That's outside of my pay grade, but I'm looking at our public health director, who is not shaking his head either way right now. Maybe because he was looking at something else and didn't hear my question.
Okay, but those are things that concern me, just like, with Amazon, exactly.
Let me get him to answer.
Okay. Okay, go ahead.
I believe that if you're a close contact of a confirmed case, then yes, you would be qualified. But I would again direct the person to the website also, because it asks all those questions and goes through the logic that's built behind it. And based on all the signs and symptoms and everything else that you've mentioned, that person can answer those questions correctly at covidtesting.tarrantcounty.com, and then it will tell you whether you're qualified to get a test at this location, or it will give you information about what to do if you're not qualified to get a test. It still gives you good guidance on what the person should do.
Okay, thank you, Cynthia.
Thank you.
Next is Jerry Lynn Cox.
Hello.
Jerry Lynn, this is Judge Whitley, and you had asked to speak to an item on our agenda, and I'm calling you to give you that opportunity. Please repeat your name, your address, and then you have 3 minutes to make any comments you wish to make.
Thank you, Judge Whitley. My name is Geraldine Cox. I live in Fort Worth. My zip code is 76132. I'm calling because at your suggestion, I went to the website and looked up what one does to do to be tested. And what I got was an instruction that would basically, unless I had a fever of 100.4 and other symptoms, then I would not be eligible to be tested. There was nothing on that suggested. The last conversation was about whether people who lived with someone who'd just been confirmed as COVID positive could be tested. So I guess my first comment is might have somebody with the health department check the website and be sure that it contains the most up-to-date information, because what's there now dissuaded me from even bothering to fill out the survey. My second comment about testing is that the point in my mind, at least, is to let us know when it's safe for many more people to return to work, and who safely may return to work, and who shouldn't return to work. It's a question of public safety. And as you correctly pointed out, without the fill-in data of the test results from private corporations, and without more testing, we're still kind of shooting in the dark. That's part of why many of us who are in the over 65 with histories of difficulties physically are so frightened by the decision to open up when case statistics are still increasing. So my request to the Commissioner's Court will be that you watch those stats very carefully, because if case numbers are still going up as we get closer and closer to May 18th, you have the option, I think, and I hope you would take the responsibility of speaking to the governor and saying, these plans don't work for Tarrant County. Please don't impose one size fits all on Tarrant County and Dallas County, because one size fits all may not really suit us. We need your protections, and so I know you're concerned, and I'm asking that you carefully balance the economic interests of the county against the safety factors, because it seems to me that in the end, if we don't make everybody safe, we don't do ourselves a lot of favor by expanding business prematurely. Thank you.
Thank you very much for your comments. Next is Bruce Miller. Bruce? I guess he didn't want to talk. Try this one more time.
Good morning.
Bruce.
Yes?
This is Judge Whitley. You had indicated that you wish to speak regarding one of the items on our agenda, so I'm calling to give you that opportunity. Please repeat your name, and then you have 3 minutes to make any comments you wish to make.
My name is Bruce Miller. I live in Fort Worth. I'm a retired professor from TCU. Thank you for your call. Both of the models and the data show that the COVID infection is more widespread. Strong mitigation methods need to be continued to confirm the spread. The reopening in Tarrant County is premature and will lead to more infection and death. The county needs to inform the governor that he needs to reconsider his approach. The county needs to point out that it should have authority to implement stronger mitigation efforts in order to protect the population. And so I hope that we can take a stronger, more aggressive approach in dealing with the state to let them know that we need to protect our population.
Okay, Bruce, thank you very much for your comments.
Thank you.
That is all of the comments I have regarding COVID-19. So, Mr. Manius, I'll turn it back over to you now for any actions
Judge, you have a comment here about the asthma 4011 proclamation that we passed this morning.
Yes, I do. So I'll go ahead and give that individual, I missed that earlier, so give that individual a chance to speak. Marquita Jones, I'm getting ready to call you.
The person you want to reach is not currently available.
Marquita Jones
is out of the office.
Hello, this is Marquita Jones with the Healthy Homes Asthma Program with Cook Shields. I will be out.
We'll try Marquita again before we end our court session. Mr. Manius.
Thank you, Your Honor. Members of the court, we can go to the administrator's section. On item number 1, we placed this on there simply if there was any additional information we would receive from the governor's office. The only thing I'd like to report on that is that I believe there's a 2:30 call this afternoon, or press conference, and where the governor will provide additional information on COVID. If we can go to item number 2, so we're not requesting any action on item number 1. So we're going to go to item number 2, and we have one additional item that we'd like to seek the court's approval. We're requesting that the Commissioner's Court approve an agreement between Tarrant County and Murnahan Public Relations, Inc., to provide assistance in the PIO office at Public Health. This is for a contract for no more than 24 hours a week at a price of $60 per hour, and we're requesting the Commissioner's Court approval.
What is this for? I mean, I heard
It's
what you
to
said,
assist. We have one PIO in public health, and we're running 24/7 on public health, and we need some assistance. And while our office provides some assistance, this will provide another person, and this person is well known to our PIO officer, and we vetted this person, so we're requesting approval on this contract.
Move for approval.
Second.
We have a motion, a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
So we can move to item number 3, and I'm going to ask the county auditor to come up and make this presentation.
So today we're requesting, as you went through the various discussions over several court meetings related to the Emergency Sick Leave Act and the Expanded Family Medical Leave Act, there were a few times that there was some detailed information, and there was a lot of discussion about the regular rate of pay versus basic compensation. And this is just some house cleaning, and that both of those acts actually state that we are to use the regular rate of pay. There will be instances where we may look at using basic compensation because our goal is to keep employees whole. But this is really a house cleaning item where we're requesting the court approve using the regular rate of pay for those federal funds related to the COVID-19.
I'll move approval.
Second.
We have a motion, a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes 4-2. With Commissioner Brooks, it passes unanimously with Commissioner Brooks out for the moment.
Okay, members of the court, if we could now go to item number 4. We're requesting that the Commissioner's Court approve a new local agreement between Tarrant County and the City of Saginaw for the regulation of game room operations within its municipality.
Before we move on,
I move
Commissioner,
approval.
Second.
We have a motion and a second. Before we vote on that, Commissioner Brooks, would you care to have voted on the motion that was made while you were gone?
Sure, I vote yes.
Okay, any discussion on this particular issue? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Finally, members of the court, on item number 5, we're requesting that the Commissioners Court approve an agreement between between Tarrant County and Texas Local Government Corporation as it relates to Texas Prosecutor Case Financials Development Agreement.
I will move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. And with that, we're going to take a 5 to 10 minute break.
Second.
We have a motion and a second to receive and file the personnel agenda. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you and good morning. We have one additional item, that's item 2. We're asking the court to approve a waiver of terminal benefits for the Sheriff's Office. Sheriff Wayburn is requesting a waiver of 289 vacation hours effective May 6, the details of which are outlined in your communique. We're estimating the net cost to the general fund to be a little less than $900. That does include fringe benefits.
Move approval.
Move approval.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Your Honor, Public Health has 2 items. The first one, we're requesting that the court approve a contract for outdoor advertising with Clear Channel Outdoor. Clear Channel on behalf of Tarrant County Public Health Department. This will provide digital space, and it's donated, and it'll be whenever that space is available, so there's no cost to the county.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
So on item 2, we're requesting that the court approve the submission of a grant application to CDC, which would be used to assist in the development of a strong public health approach to Alzheimer's and other related dementia. This is going to be a combination between Public Health, UNT Health Science Center, and the Alzheimer Association.
Move approval. Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you, Your Honor.
Mr. Beecham?
We have 3 items for your consideration this morning. Our first item is a bid award recommendation for bid 2021-112, signing a contract for trailer-mounted chippers. Our recommendation would be to award on a per enterprise basis, awarding to Vermeer, Texas, Louisiana.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Item number 2, also a bid award recommendation for bid 2021-15, signing a contract for the purchase of a color production, digital press, and maintenance for a reproduction center. Recommendation would be to award a per enterprise basis, awarding to a company called UBO.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote.
Those are great people working down there.
Commissioner Johnson?
Yes.
Motion passes unanimously.
Last item in regards to RFP 2020-061. This was an RFP for meeting and agenda management solution for the Information Technology Department. We are suggesting and recommending rejection of all proposals and suggesting that we rebid with revised specifications.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Thanks, Jack. Wendy?
Good afternoon, just afternoon today to the Judge and Commissioners Court. I'm very excited to be here today to talk about our results of our service organizational controls. It is requested that you receive and file the statement of controls audited prepared by the Whitley Penn accounting firm for the Tarrant County Tax Office. Each of you should have an original copy for your review. This audit is routinely requested to determine the processes, procedures, and controls in the tax office, that they are suitable, effective, and being utilized as determined by our policies and procedures in managing the property tax assessment and collection functions. This review is important not only for Tarrant County, but also for the other 78 taxing authorities in the county as well. With a levy over $4.5 billion and over 2 million accounts, the task is not only challenging but vital for local effective government. I am very pleased to report that the outside auditors found absolutely no deviation from the prescribed controls. These results were obtained by testing samples of tens of thousands of transactions over the audit period. The sustainability of the design and operating effectiveness of our controls covered the period from September 1st, 2019 through February 29th, 2020. That's all my time as your one-year tax assessor collector. While the audit is performed on a regular basis and the results have been more than acceptable in the past, this is the first time in more than 20 or possibly more years that there have been no exceptions noted in the report. My staff was actually astonished. They said, we can't remember a time when this has happened before. This outstanding result can only be attributed to the hard work and dedication of property tax, motor vehicle, accounting, and quality assurance teams. I've been fortunate enough to challenge these teams by asking many of these why do we do these questions and testing the system myself in addition, since I am wholly responsible for every single dollar that comes through the tax office. I want to acknowledge the contributions of our friends in the IT department, as routines related to the tax office with them were audited as well. The stellar report is in part a result of the good work that they also perform as security measures, and we appreciate Darren and his team in InfoSec as well as other silos within this effort. So thank you guys. Darren really wanted to be here with me today, so hi buddy. Thanks for letting me take the opportunity to call out this outstanding report to your attention. I am proud to be a part of the Tarrant County Strong Team. I appreciate your consideration and ask for your approval of filing of this document, and I always thank you for your continued support of the tax office.
Move to receive and file.
Second.
We have a motion and a second to receive and file. I would like to just go on record as saying that I have not been and had any ownership percentage in Whitley Penn since 2015. So therefore, there's no question with regards to independence. And if I had, they wouldn't have been able to do the audit.
Correct.
So with that, please vote. Commissioner Johnson? Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you so much for your time.
Come on down.
Good afternoon, Commissioner. Mike Galizio of the Transportation Services Department. I'll be presenting the next two items. Item 9J1 is the first of two interlocal agreements related to the Raglan Road widening project. The other item will be item 9K2, which will be coming up shortly. The Raglan Road project is a partnership project with the City of Grand Prairie and is located in Precinct 2. It's one of the last remaining original bond program projects, and is now proceeding to construction. We've actually created a web page for this project, so that includes information about the schedule, the scope, and city contacts. The approval of this agreement will authorize staff to reimburse the city for their construction costs. The total amount of bond program previously approved by the commissioners has not changed, and this concludes my presentation. I can now answer any questions.
Move for approval.
Second.
We have a motion, a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Moving on to item 9J2, this is an amendment to an existing interlocal agreement for the Alliance Texas Hazlet Accessibility Improvement Project, which includes the construction of the new Hazlet Parkway project. This is a partnership project with the City of Hazlet. It is located in Precinct 3. This is one of our newer projects in the bond program that's funded with Precinct 3 discretionary funds. We've created a web page like the Raglan Road project to provide additional information. The approval of this amendment basically was requested by the City of Hazlet. Last July, you approved that agreement that requested part of the money be used for design. The city has asked for additional money for design, and the letter that came with that request is attached to the communication. So essentially, this does not change the total funding amount for the project. It's just shifting funds from one phase to another. And so this concludes my presentation. I can now answer questions.
Move for approval. Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Commissioner Brooks, I believe you have an interlocal agreement?
Yes, this is a series of transactions regarding the same project. Back in, several meetings ago, we passed an interlocal agreement with the city of Everman, which included 2 parking lots in the same interlocal agreement. I wish to now rescind that interlocal agreement. That's item 9K1A. And then items B, C, D, E, and F, split those 2 parking lots into 2 separate interlocal agreements and give the requisite approval to commence construction under those. So I would ask for approval of items 9K1A through F.
Second.
We have a motion and a second. Now, Commissioner Brooks, A and B indicate a rescinding. Is that correct? I want to be sure.
One is the interlocal agreement. A is the interlocal agreement. B is permission to proceed construction under that interlocal agreement. And then C, D, E, and F are the 2 new interlocal agreements and permission to proceed under those 2 interlocal agreements.
Good. Okay, any further discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Commissioner Allen?
Yes. Move for approval for item 9K2A and B.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Are there any appointments? There being none, then you have before you the claims, including the addendum.
Move approval of the claims, including the addendum.
Second.
We have a motion and a second to approve the claims, including the addendum. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. We don't have a closed session.
Yes, we do today.
We do have a closed session. Okay, well, first off, we've got some public comments that need to be made. So the first person that I'm going to call is Jonathan Cardarian.
Hello, this is Jonathan Guavian.
Jonathan, this is Judge Whitley. You had requested to make a public comment today. So at this time, please state your name, your address, and you have 3 minutes to make any comments you wish to make.
Thank you, Judge. My name is Jonathan Guavian. I live at 3325 Martin Street, Fort Worth, Texas 76119. And today I would like to address the Commissioner's Court regarding the 287G agreement. According to the Texas Commission of Jail Standards, as of April 30th, 2020, there are currently 77 inmates who have tested positive for COVID-19. 6 of them are pending test results. There are 14 jailers who have tested positive and 52 pending test results. The coalition I saw at term believe that with these unprecedented and evidently unimaginable times, also prompt the Tarrant County Sheriff's Office to suspend Tarrant County's 287G program once the program is up for vote next month in June 2020. According to an article from the Fox 24 news outlet, Washington County and the state of Arkansas has resolved to suspend their 287G program to focus county resources and efforts in the fight against COVID-19. The 27th, Tarrant County has been engaged in the race to 287G agreement, which grants deputized county law enforcement to perform duties usually undertaken by ICE, such as questioning the legality status of any person that is detained who is suspected to be residing in the country illegally. If they confirm that person is in the country illegally, the Tarrant County Sheriff's Office will then issue an ICE hold and detain that person on behalf of ICE until ICE officials can arrive at the Tarrant County Jail to transport that detained person to their designated location. This program is irresponsible, badly organized, unsafe, and fiscally irresponsible. During a Tarrant County Commissioner's Court hearing in June 2019, when questioned regarding the program by the county commissioners, Sheriff Wayborn, who was the chief architect of Tarrant County's 287G agreement, could not provide satisfactory evidence as to the actual cost of the program for county taxpayers, nor any evidence whatsoever as to how this program is supposedly creating a safer community for Tarrant County. With 77 inmates and 14 jailers in Tarrant County currently sick with COVID-19 and countless more diagnoses still pending, the most sensible and responsible thing to do for Tarrant County Sheriff's Office is to suspend the current engagement in the 287G agreement and focus local resources and efforts in the fight against COVID-19. Thank you.
Thank you. Have a good day. Next is Fatima Youssef.
Hello?
Fatima, this is Judge Whitley. You had made a request to make a public comment today on an item that's not on our agenda, so at this time I will ask that you state your name and address and make whatever comments you would like to make. You have 3 minutes.
Thank you. My name is Fatima Youssef. My address is 109 Inca Road, Denton, Texas, 76209. I'm here to talk about the renewal of 287G this summer. As the community has expressed in the past, 287G has no place in Tarrant County or anywhere in the country. 287G allows local law enforcement to use their discretionary power to execute federal immigration laws that could lead to deportation, ICE detainers, and other harmful immigration outcomes. Because local law enforcement has been given this discretionary power, it has shown to be arbitrary and led to racial profiling, deeply hurting the immigrant community. If the police profess that they are enacted to protect communities, they are doing the exact opposite with 287G.
They are created and added unnecessary fear that is already in place by this administration, leaving the immigrant community to have broken trust between law enforcement, which hurt communities even more. The National Center for Biotechnology Information demonstrates how damaging this high stress and anxiety can be to immigrant families, both documented and undocumented in the U.S. for long periods of time. This is not how our community should be feeling in Tarrant County, especially during this time. As it has been brought to the Commissioner's awareness, there is an even higher anxiety with COVID-19. These times are unprecedented, and it is not known when the pandemic will end, nor how the repercussions will look like. But what is certain is that 287G allows for even more vulnerability now and the months to come for the immigrant community. There should not be fears to seek any resources such as aid or health assistance during this time or after the COVID-19 outcome. I ask that 287G not be renewed again for the sake to create a safe, welcoming community. I also know that our fellow taxpayers would not be fond of using local money in order to train deputized officers. Other counties in Texas have terminated their agreement, while others have avoided 287G from the outset. It's really important that we prioritize the community's needs instead of enforcing ICE detainers during this time and the times to come. There is an urgency and responsibility to support our community. Thank you for your time, and I hope that you take the community's concerns into account when voting for 287G this summer.
Thank you, Fatima. Have a nice day. Next is Leslie Rena.
Your Honor, I believe she just has comments that are attached to the.
Well, I know her comments are attached, but she just says she checked a box that says, "I wish to address the court." This is Fatima Rena. Leslie Rena, Arlington. Comments with regards to 287G subject matter. Hello, my name is Leslie Rena, and I live in Precinct 2. I'm addressing you today to urge you to end the 287G agreement. This agreement is not only putting an already marginalized community at risk, but is perpetuating the spread of COVID-19 in our county. When the 287G agreement was renewed last year, the argument in favor was that the agreement kept our community safe. However, the circumstances in which our community finds itself currently are not what they were last June. A recent study done by the American Civil Liberties Union demonstrates how reducing the jail population can lower COVID-19 death toll among the people in the general public. While the argument is that keeping people incarcerated protects the general public, this study demonstrates how a lack of health care inside jails make them a breeding ground for the spread of COVID-19 between correctional facility, staff, and the public. One way Tarrant County can reduce the jail population is by ending the 287G agreement, which keeps people incarcerated on ice holds. Oftentimes, the people are detained for minor offenses like traffic stops and remain in jail for days on an ice hold. In Arkansas, Washington County has already determined that their resources should be dedicated to aiding the COVID-19 response and consequently have ended 287G. And the reason why 287G must end is that it incites fear among the Hispanic community in Tarrant County. Tarrant County's breakdown of COVID-19 statistics demonstrates that Hispanics are the ethnicity with the highest positive COVID-19 cases. The continuation of 287G would further put our community at risk by creating the fear that if they decide to get tested and unfortunately miss a traffic stop sign on their way to the testing center, then they could be detained and put on an ice hold. Now more than ever, it is imperative that you allocate resources that serve all of the community. We are facing a growing pandemic, and as commissioners, your duty is to serve the needs of people living within your areas of the county. Ending 287G will send a clear message that you will do what it takes to ensure the safety of all your constituents. Okay. Henry Hildebrand, also 287G. Would like to thank the members of the court for serving the needs of our county as resident of Precinct 3. Not just speaking for himself, he says, "We are proud to call Tarrant County home. We appreciate your efforts in administering to the needs of our residents. Thank you for providing time and space to bring this comment forward, as he also believes it is to best serve the needs of the residents. This is my first opportunity to express my views before the court. Though I know similar views have been expressed already in this chamber, my hope is that the court will listen and reflect upon the ideas with an eye for what is best for our residents, those in this chamber and those who are not currently aware of these proceedings. As a member of ICE out of Tarrant County, I know that the court knows what the 287G agreement is and has heard numerous complaints about the agreements with the federal government that our county, through your administration, has decided to be a party to. I am sure you all have heard the complaint against how the agreement can sow distrust of law enforcement and in turn jeopardize the safety of our residents. I wish to emphasize the point that all of us are affected by this issue. A resident sees someone break into my car but are afraid to inform law enforcement about it. How does that make the community more safe? The fear of helping our neighbors is now exacerbated by the COVID-19 pandemic. The numbers in the infected individuals in the county jail have continued to rise. The pandemic continues to rage in facilities that concentrates individuals into confined spaces. We are grateful that our state's governor understood this concept and closed our schools. I am sure that the members of the court can imagine the reluctance any person would have with cooperating with law enforcement if there is the slightest chance of being confined in a space with a person with a deadly disease. It must be said that now, in the stark reality of the pandemic COVID-19, that the liability of this agreement for the residents of Tarrant County is stark. If law enforcement encounters a person with disease and the officer would normally serve with a citation, but because of the agreement the officer must detain and internment into our county facilities, it puts a whole group of our residents at risk. Most importantly, the arresting officer and other employees working in our detention facilities are all put at risk for our health for serving the statute of this agreement. This agreement will risk the lives of our county employees and the families they go home to. Washington County and Arkansas answered that question with a no and superseded the agreement for the good of their residents. I ask you all to do the same. Thank you and have a good afternoon. That's all the public comments that I have. If there's no further business, then we will recess our open meeting and proceed to close to discuss items exempt under section 551.071, 072. We're filming. I said, well, they'll come running. Having returned from our closed session, there being no business to conduct at this time, we stand adjourned.